Welcome to the Mystery and History channel. Be sure to subscribe and like so you don't miss out on more videos like this one. Phineas Gage became an iconic figure in neuroscience after a serious accident in September 1848 when a 3-foot 7-inch iron bar struck the front part of his head while he was working on railroad construction in Vermont, United States. Despite the seriousness of the injury, Gage survived and remained conscious shortly after the event, but his behavior was said to have changed in a major way. Once responsible and admired, he was later described as impulsive and disorganized, affecting his social and professional life. The episode was essential in expanding the understanding of the relationship between different regions of the brain and human behavior, opening a new field of study about the mind. Gage kept the iron bar as a keepsake until the end of his life, and today the object and part of his anatomical remains are preserved in the Medical Museum at Harvard University. His story became a landmark in understanding the connections between the brain and certain personality traits. Alexis St. a young Canadian fur trapper, became a central figure in medical history after suffering a serious accident in June 1822 on Mackinac Island, Michigan. He survived and was left with an abdominal opening that worked like a kind of window into his stomach, allowing never-before-seen observations of the digestive process. Army Dr. William Beaumont used this unusual condition to conduct direct studies, placing small food samples in a controlled way and examining their changes over 8 years. This pioneering method led to the first detailed treatise on human digestive physiology, transforming science in the 19th century. Despite St. Martin's crucial cooperation, his participation was marked by conflict and reluctance. After his death in 1880, his family carefully protected his grave to prevent his remains from being removed without permission in the name of science, preserving his dignity against the medical practices of that period. Joseph Merrick, historically known by the nickname the Elephant Man, showed unusual changes in bone and tissue growth from childhood, significantly affecting his face, skull, arms, and torso. Born in Leicester, England in 1862, he faced great difficulty living independently and eventually worked for several years in public exhibitions as a way to support himself. In 1886, surgeon Frederick Trevis helped remove him from that environment and secured a place for him at the London Hospital, where Merrick spent his final 4 years surrounded by care and respect, receiving visits from members of the aristocracy and the British royal family. Described as kind, intelligent, and sensitive, he challenged the prejudices tied to his appearance. Merrick died in 1890 at age 27, probably because of a respiratory complication related to the position in which he slept and the weight of his head. Today, it is believed that his condition was mainly connected to Proteus syndrome, whose study expanded medical knowledge about genetic growth disorders. Charles Byrne, nicknamed the Irish Giant, stood out in the 18th century for his impressive height of about 7 feet 7 inches, a rare condition that inspired fascination and scientific curiosity. Born in Ireland in 1761, he moved to London in search of income through public exhibitions, gaining some local fame. Aware of the interest of anatomists, especially Surgeon John Hunter, in studying his remains to understand gigantism, Byrne tried to make sure his wishes would be respected, paying to be placed in a lead coffin and buried at sea after his death in 1783. However, Hunter secretly negotiated with those responsible and managed to obtain his remains, going against the instructions Byrne had left. His skeleton remained in a scientific collection for more than 200 years. In 2023, a new campaign called for his remains to be removed from display and given a respectful destination, restoring the dignity and wishes he had expressed in life. Walter Freeman was a controversial figure in American psychiatry who, beginning in 1945, popularized a simplified form of lobotomy performed through the orbital area to alter connections in the frontal lobe. Because it did not require part of the structure needed for traditional surgery, the technique spread quickly through psychiatric institutions in the United States. Freeman traveled in a vehicle nicknamed the lobotomobile, giving demonstrations and conducting thousands of procedures, estimated at more than 3,400 over his career. Although some patients showed changes considered positive at the time, many developed serious adverse effects, including permanent changes in behavior, independence, and motor ability. Among the best-known cases was Rosemary Kennedy, whose life was severely affected. The practice was gradually abandoned during the 1960s after serious outcomes and with the spread of antipsychotic medications. Freeman continued defending his work until his death in 1972, convinced that his methods had helped more people than they had harmed. Mary Mallon, known as Typhoid Mary, was an Irish-American cook identified in the early 20th century as the first asymptomatic carrier of typhoid fever in the United States. Even without showing symptoms, Mary transmitted the disease in every home where she worked in New York between 1900 and 1907, causing fever outbreaks and thousands of infections. Epidemiologist George Soper was responsible for uncovering the link between the outbreaks and Mary after a careful investigation. When confronted, she reacted aggressively and fled, but was eventually detained by health authorities. Kept in isolation for 3 years on an island in the East River, Mary was released under the condition that she would not cook for other people again, an agreement she broke in 1915 when she caused another outbreak in a hospital. Returned to confinement, she spent the rest of her life isolated until her death in 1938, leaving an important landmark in the debate over the tension between public health and individual rights during epidemics. Evan O'Neill Kane was an American surgeon who challenged the medical practices of his time by showing that certain operations could be performed with local anesthesia instead of general anesthesia, which was then considered more unpredictable. In February 1921, at age 60, Kane became the participant in his own procedure to treat his appendix using local anesthesia and remaining conscious while he was accompanied by a medical team. The operation lasted about 30 minutes, and the surgeon kept communicating with his colleagues throughout the process. 10 years later, he personally took part in another procedure, this time to repair an inguinal hernia, again using local anesthesia. These demonstrations received major press attention and influenced the reevaluation of excessive use of general anesthesia in some interventions. Kane died in 1932 from pneumonia, with no direct connection to the experimental procedures he had performed. Henrietta Lacks, a black woman from Baltimore, entered medical history in 1951 when tumor cells were taken without her knowledge during treatment for an aggressive cervical cancer at Johns Hopkins Hospital. Researcher George Gay was able to grow these cells, called HeLa, which surprised the scientific world by dividing indefinitely and becoming the first immortal human cells in a laboratory. This discovery revolutionized medical research in the 20th century, making possible the development of the polio vaccine, advances in cancer studies, and drug testing, while even being used in space experiments. Henrietta died that same year, never knowing the importance of her cells, which were revealed to her family only decades later, raising debates about ethics and consent in science. HeLa cells transformed modern medicine, but they also exposed inequalities and omissions in the recognition of donors. John Paul Stapp was an American doctor and Army colonel who defined the 1940s by investigating the limits of the human body under extreme forces. Seeking to understand the effects of deceleration on pilots and improve safety during aviation incidents, Stapp personally took part in more than 29 tests performed on a rocket sled in the New Mexico desert, subjecting himself to very rapid acceleration and stops. In 1954, he reached a speed of about 632 miles per hour and stopped in only 1.4 seconds, enduring a force equal to 46.2 times gravity, considered the highest voluntarily recorded at that time. The experiment caused important physical effects, including eye changes and temporary vision impairment, from which he recovered in the following days. His study showed that the body could withstand forces higher than earlier estimates, influencing the development of seatbelts for airplanes and automobiles. Recognized by Time magazine as the fastest man on Earth, Stapp lived to age 89 and became a symbol of safety research. Albert Hofmann, a Swiss chemist who influenced science and culture, discovered in April 1943 the properties of a psychedelic compound later known as lysergic acid diethylamide, synthesized from derivatives of the ergot fungus in his laboratory in Basel. After accidentally coming into contact with a small amount of the substance, he experienced intense changes in perception and sensation during his bicycle ride home. 3 days later, he carried out a new controlled test to confirm that the compound was responsible for the observed effects, beginning a new stage of research on the mind, consciousness, and certain psychiatric disorders. Despite later legal restrictions, the substance was studied during the 1950s in clinical contexts and has recently returned to investigation for its possible therapeutic potential in difficult-to-treat conditions. Hofmann lived to age 102 and called his discovery his problem child. His work remains a relevant chapter in the history of neuroscience, psychiatry, and global counterculture. Barry Marshall, an Australian doctor, challenged a dominant medical belief in the 1980s by showing that the bacterium Helicobacter pylori was connected to the development of stomach ulcers, contradicting the idea that the stomach was sterile and that these lesions were caused only by stress or poor diet. After facing rejection from the scientific community and having his work turned down at conferences, Marshall underwent a voluntary and controlled exposure in 1984 to the microorganism he was studying. A few days later, he developed stomach inflammation that was treated with antibiotics, strengthening the evidence for his hypothesis. Resistance to the new theory continued for years, but his persistence transformed ulcer treatment around the world as ulcers began to be treated with specific medications. Along with his colleague Robin Warren, Marshall received the Nobel Prize in Medicine in 2005 for a discovery that deeply affected global health, considering that a large part of the population carries Helicobacter pylori in the body. Werner Forssmann was a cardiology pioneer who revolutionized medicine in 1929 by performing the first cardiac catheterization on a human being, using himself as the participant in an experiment considered extremely controversial at the time. Working in a hospital in Germany, he challenged medical conservatism by showing through X-ray images that a flexible instrument could reach the heart area through circulation without immediately causing the complications many specialists feared. His initiative opened the way for methods capable of diagnosing and treating heart disease with greater precision. At first, Forssmann faced skepticism, criticism, and resistance from the scientific community, but his method became fundamental to modern cardiac exams and interventions. The importance of this innovation was recognized only decades later when he received the Nobel Prize in Physiology or Medicine in 1956, securing his place in the history of cardiology. Jesse Laziar was an American doctor and researcher whose dedication marked the history of tropical medicine in the early 20th century. In 1900, as part of the team led by Walter Reed and sent by the United States Army to Cuba, Laziar investigated the dangers of yellow fever, a disease affecting soldiers and civilians, seeking to prove the hypothesis that it was transmitted by the Aedes aegypti mosquito. He coordinated controlled studies with volunteer participants, observing the connection between mosquito contact and the later appearance of the illness. During the research, Laziar contracted the disease, although it remains debated whether the exposure was intentional or accidental. He died in September 1900 at age 34, leaving behind a wife and 2 young children. His work was decisive for the implementation of mosquito control measures, helping reduce yellow fever in Havana, and deeply influencing public health in the Americas by confirming the role of Aedes aegypti in transmission. Stubbins Firth, a young doctor in the early 19th century United States, drew attention while investigating yellow fever, a disease that worried American cities and whose method of transmission was still unknown. Determined to show that it did not pass directly from one person to another, he subjected himself to a series of experimental exposures using samples obtained from patients, using methods that today would be considered reckless and incompatible with ethical standards in medical research. Surprisingly, Firth did not develop the disease and wrongly concluded that it was not contagious. The problem was that the virus is transmitted mainly by mosquitoes, while the samples used had probably been collected during stages when the infectious agent was no longer active. Even though he reached an incorrect conclusion, his experiments indirectly contributed to later discussions about contagion, showing the search for answers in the face of a disease that was still poorly understood. Max von Pettenkofer was a renowned German hygienist of the late 19th century who challenged the emerging germ theory of disease. In 1892, at age 74, he drew attention by voluntarily undergoing an experimental exposure to Vibrio cholerae sent by Robert Koch, whose work argued that cholera was caused by this bacterium. Pettenkofer believed that environmental factors, such as groundwater quality and soil temperature, were also essential for the disease to develop. Although he experienced only mild discomfort and did not develop a severe illness, he interpreted the result as confirmation of his own ideas. Modern science considers that possible previous immunity or other circumstances probably protected him without invalidating Koch's discoveries. Pettenkofer died in 1901 under tragic personal circumstances after spending decades defending a hypothesis that was eventually surpassed by scientific progress. James Marion Sims is often called the father of modern gynecology because of his medical innovations, especially the development of procedures to treat vesicovaginal fistulas, a condition that caused incontinence and social isolation in some women after childbirth. Between 1845 and 1849, Sims conducted experimental procedures on at least 8 enslaved women in Alabama, repeating interventions without adequate pain control resources and without free consent. His actions were supported by a racist and scientifically false belief that black women felt less pain. These practices caused serious ethical violations and turned his legacy into the subject of intense debate today. While some scholars recognize the influence of his discoveries on medicine, others question the public celebration of his image, leading to the removal of statues in New York and Alabama after protests. Sims's path reveals the moral dilemma tied to the human costs that accompanied certain scientific advances. Ignaz Semmelweis, a 19th century Hungarian doctor, revolutionized medicine when he discovered in 1847 at Vienna General Hospital that the high number of complications after childbirth was connected to poor hygiene among doctors who left the autopsy room and treated patients without properly washing their hands. By introducing the mandatory use of a chlorine solution for disinfection, Semmelweis drastically reduced severe cases in the ward he supervised, reaching near zero results during certain periods. Despite the evidence, his theory was rejected and mocked by professionals who refused to accept the possibility that their own practices were worsening the condition of patients. Persecution and professional conflicts contributed to a serious decline in his emotional state, leading to his admission to a care institution in 1865. He died only a few weeks later from health complications. Years later, with advances in knowledge about microorganisms, his contribution was recognized as fundamental to antisepsis and modern hospital safety. John Snow, physician to Queen Victoria, marked the history of medicine by revolutionizing the understanding of epidemics during the cholera outbreak in August 1854 in the Soho district of London. At that time, people believed cholera spread through the air by so-called miasmas, but Snow doubted that theory. Determined to prove his hypothesis, he went door to door, recording cases and identifying their water sources. He then drew maps that showed a concentration of infected people around the Broad Street water pump, near a cesspit. Removing the pump handle immediately interrupted the outbreak, confirming that the disease was transmitted through contaminated water. Although he did not know exactly how the contamination occurred, his research laid the foundation for modern epidemiology, the science that studies patterns and causes of disease. John Snow died in 1858, leaving a fundamental legacy for public health. Daniel Hale Williams was an African-American surgeon whose work revolutionized medicine in the 19th century when he performed one of the first successful open-heart surgeries in history in 1893. At Provident Hospital in Chicago, an institution he created to fight discrimination in medical careers, Williams operated on James Cornish, who had a serious wound very close to the heart. The doctor performed a pioneering intervention in the chest area at a time before antibiotics and modern transfusion techniques were available. The success of the procedure not only saved Cornish, who lived for about 50 more years, but also challenged medical and social norms in a segregated America. Williams faced a double struggle, overcoming the technical limits of the period and breaking racial barriers. In 1913, he became the only black doctor among the founders of the American College of Surgeons. He died in 1931, and his contribution received broader recognition only decades later, revealing the importance of his legacy for inclusion and medical progress. James Blundell, a London obstetrician of the early 19th century, revolutionized medicine in 1818 by performing the first documented human blood transfusion, using a syringe to transfer blood from a husband to his wife, who was facing severe blood loss after childbirth. At that time, complications of this kind were among the leading causes of fatal outcomes for women, while earlier attempts at transfusion between different species often produced very harmful results. Aware of these difficulties, Blundell dedicated himself to developing his own instruments, including a syringe system that would serve as a reference for later devices. Over the following years, he performed 10 transfusions, 5 of which had positive results, a remarkable advance given the technical limits and lack of knowledge about blood groups. That understanding would only come in 1901 with Karl Landsteiner. Blundell's initiative prepared the ground for a safer and more effective practice that would deeply transform medicine in the following decades. Crawford Long was a Georgia doctor who, in March 1842, performed the first known surgery using ether as a chemical anesthetic to remove a tumor from the neck of his friend James Venable, who felt no pain during the procedure. Despite this revolutionary achievement, Long did not publish his results or inform the scientific community at the time, which prevented immediate recognition. Only in 1849, after the discovery became a national controversy because of the dispute with dentist William Morton, who publicly demonstrated the use of ether in Boston in 1846, did Long reveal his notes. Although the medical community recognized his priority, credit in most books was given to Morton. Long is honored in the United States Capitol Rotunda representing Georgia, but he remains a little celebrated figure compared with Morton, showing the complex dynamics of scientific recognition in the 19th century. René Laennec was a French doctor whose innovation transformed medical practice when he invented the stethoscope in 1816, after facing the challenge of listening to the heart of an obese patient at a time when the traditional method of placing the ear directly on the chest was limited and inappropriate for young women. Laennec had the idea of rolling 24 sheets of paper into a cylinder, creating a simple tube that amplified heart sounds with never-before-heard clarity. He spent the following years improving the instrument, replacing paper with wood, and developing a two-part tube that he named stethoscope, from the Greek meaning to observe the chest. In 1819, he published a detailed treatise on the sounds of the heart and lungs, marking a new era in clinical diagnosis. In a twist of fate, Laennec died in 1826 from tuberculosis, the disease his device helped detect more efficiently. His invention remains a symbol of medicine to this day, a fundamental tool born from simple creativity in a moment of need. Virginia Apgar revolutionized newborn medicine in 1952 by creating the Apgar score, a simple and effective tool for quickly assessing the condition of newborns in the first minute of life. Before this method, there was no standardized way to identify babies in critical condition during the first hours after birth, which contributed to high newborn death rates. She wrote the idea on a napkin during breakfast, establishing 5 criteria: heart rate, breathing, muscle tone, reflexes, and skin color, which together show whether immediate intervention is needed. Besides being a respected anesthesiologist, Virginia was an airplane pilot, musician, and instrument maker, a woman of many talents who dedicated her later years to the study of birth defects. Her score, adopted worldwide, has already evaluated billions of babies, saving countless lives and marking an essential advance in 20th century medical practice. William Halsted is considered one of the most influential figures in modern American surgery, having introduced procedures such as radical mastectomy, new techniques for hernia repair, and the use of rubber surgical gloves. In the late 19th and early 20th centuries, he stood out at Johns Hopkins University, where he trained professionals who helped transform medicine in the United States. His path also had a little-known side. Halsted developed a long-term dependence on substances used as anesthetics and pain relievers, a problem that began during his experiments with local anesthesia in 1884. Despite treatment attempts, he continued working while dealing with the condition, which was kept secret by colleagues and superiors because of the professional results he delivered. After his death in 1922, private records from his mentor, William Welch, made the situation public, sparking debates about ethics, professional performance, doctors' health, and chemical dependence within medicine. Alice Hamilton transformed occupational medicine by exposing workplace diseases in the early 20th century, when many American workers became ill from exposure to toxic substances such as lead, mercury, and arsenic in factories and mines. She visited these places, spoke with workers, and investigated the causes of the illnesses, producing the first detailed scientific documentation of lead poisoning in 1910 in the United States. Her pioneering work pushed forward the first workplace safety regulations while facing resistance from employers and academics. In 1919, she became the first woman on the Harvard faculty, facing discrimination but never giving up. Her dedication to the chemical risks of industry lasted for decades, and she lived to age 101, ensuring that occupational medicine had firm roots in her brave visits to factories. Andreas Vesalius was a 16th century Flemish pioneer who revolutionized medicine by challenging the authority of Galen, whose ideas were based mainly on animal studies and had dominated since antiquity. While studying in Paris, Vesalius faced social taboos and legal limits on conducting direct research into human anatomy, even obtaining human remains outside officially permitted channels. His observations corrected more than 200 points in traditional texts, showing, for example, that the cardiac septum was solid and that the human liver did not have the 5 lobes described by Galen. In 1543, he published De Humani Corporis Fabrica, a work accompanied by detailed illustrations that established the foundations of modern anatomy. Vesalius faced severe criticism from former teachers and accusations related to his practices and beliefs. His life ended in 1564 during a difficult return trip from Jerusalem. His legacy marked the transition between medieval knowledge and the scientific method, establishing anatomy as a discipline based on direct observation. William Harvey, a 17th century English doctor, revolutionized medicine by proving blood circulation, challenging a dogma that had lasted for more than 1,400 years and followed the ideas of Galen from the 2nd century. In 1628, he published a 72-page book detailing his experiments with arteries and veins in living animals, in which he measured blood flow and proved that the liver could not produce the amount of blood needed to supply the body, as people believed. Harvey showed that blood circulates repeatedly, driven by the heart, a discovery that faced strong resistance and mockery from doctors of the time because it challenged an ancient authority. Despite the difficulties, his theory was gradually accepted and redefined knowledge of human physiology. He died in 1657, leaving an indelible mark on the history of science and medicine. If you enjoyed this video and want to support the channel, please use the Super Thanks tool below. Your contribution helps us keep bringing you amazing historical content. Thank you so much for your support, and see you in the next video.